Every day, patients walk into clinics with one simple complaint: I'm exhausted. And here's the surprising part. Multiple studies show that when patients present with fatigue, a clear diagnosis is only found in about 27 to 47% of cases. That means more than half of patients will never get a definitive explanation. We need to do better. And today, I want to show you why fatigue is often far more complex than basic lab work. Because if your labs were normal, but you still feel terrible, your fatigue deserves another look. And one of the most common causes of fatigue is something almost nobody suspects. We'll come back to that in a moment. When doctors evaluate fatigue, we usually start with common and serious causes. Historically, the most frequent diagnoses include anemia, vitamin B12 deficiency, infection, pregnancy, and psychiatric conditions. But what happens when the basic labs all look normal? Modern medicine operates under very real constraints. Insurance denials, cost concerns, pressure for efficiency. Over time, this can unintentionally create what I call cost-conscious bias, where evaluations may lean toward what is easiest to approve rather than what is clinically ideal. Fatigue is especially affected because insurance coverage for extended evaluations is often inconsistent and must be tied to associated diagnoses the patient already has. But normal basic labs do not mean fatigue has no cause. They simply mean the most obvious problems were excluded. Now the real thinking begins. Remember that common cause I mentioned earlier? One of the most frequent and most overlooked causes of fatigue is medications. Many widely used drugs can significantly impact energy levels. Antidepressants, beta blockers, benzodiazepines, gabapentin, sleep aids, and antihistamines. Patients often assume fatigue must be a disease, when sometimes it is a side effect. Never stop medications on your own, but this is an extremely important discussion to have with your doctor. But medications are only the beginning. Let's move into causes that basic labs frequently miss. What if you are having more than just fatigue, chest pain, palpitations, shortness of breath, swelling, cough? Your fatigue could be coming from abnormal heart rhythms, an enlarged heart, chronic obstructive pulmonary disease, coronary artery disease, heart failure, pulmonary hypertension, sarcoidosis, or even the valves of your heart. In these cases, testing may include EKG, chest X-ray or CT, heart ultrasound, Holter monitor to evaluate heart rhythm, lung function testing. Vitamin deficiencies are another major category, and importantly, symptoms can occur even when values fall within population reference ranges. Relevant nutrients include vitamin B12, folate, vitamin D, and iron. Iron deficiency deserves special emphasis. You do not need to be anemic to be iron deficient. Low ferritin levels can be associated with fatigue, hair changes, cold intolerance, and brain fog, particularly in menstruating women or patients with recent blood loss. Hormones play a massive role in energy regulation. Clues may include low libido, sexual dysfunction, irregular menstrual cycles, hot flashes, weight changes. Considerations may include low testosterone, perimenopause, menopause, or thyroid dysfunction. A full thyroid panel can sometimes provide insights beyond TSH alone. You may also benefit from other hormonal levels being checked, such as your testosterone and estrogen. What about unexplained weight loss, low blood pressure, dizziness, nausea and vomiting, muscle and joint pain, skin darkening? You could be dealing with adrenal insufficiency. A morning cortisol and an adrenocorticotropic hormone level could give you answers. Fatigue after meals, irritability with hunger, energy crashes in the afternoon. You could be dealing with blood sugar swings and insulin resistance that would not be caught on a metabolic panel and A1C. Fasting insulin levels, glucose checks during these episodes, or even continuous glucose monitoring could shed insight into your symptoms. In addition to fatigue, are you dealing with diarrhea, abdominal pain or bloating, nausea and vomiting? Celiac disease can present with everything from abdominal symptoms to weight loss, joint pain, anemia, rashes, brain fog, headaches, and many more. A celiac panel can give you an answer, but it is important to not stop gluten until you get your testing done. Inflammatory bowel disease can also present with similar symptoms, but you may also see weight loss and bloody diarrhea. In this case, GI scopes and biopsies are definitely necessary to try to get to the bottom of your diagnosis. Small intestinal bacterial overgrowth can mimic irritable bowel syndrome with chronic abdominal pain, bloating, excessive flatulence, diarrhea, and nausea. The best step here would be seeing a gastrointestinal specialist for breath testing. Poor sleep is a huge driver of fatigue, and obstructive sleep apnea is commonly missed, especially in women and non-obese patients. Warning signs include unrefreshing sleep, snoring, morning headaches, daytime sleepiness. Sleep studies can be transformative for the right patients. Fatigue is a hallmark of many inflammatory conditions. If you are dealing with joint pains, rashes, or weakness, an underlying rheumatologic disease could be causing your fatigue. Examples include rheumatoid arthritis, lupus, polymyositis, polymyalgia rheumatica, and fibromyalgia. Further testing may involve antibodies, inflammatory markers, and imaging. Are you suffering from exercise intolerance, muscle weakness? Several mitochondrial diseases can present in adulthood, and with their non-specific symptoms, there may be a delay in diagnosis for years. This diagnosis requires a high index of suspicion, as many cases likely go undiagnosed due to the diverse symptoms at presentation and diagnostic challenges. If this is suspected, finding a specialist for testing is definitely the best next step. They may consider checking biomarkers such as GDF-15 or FGF-21. If fatigue is associated with dizziness on standing, rapid heart rate, brain fog, difficulty regulating your temperature, orthostatic vitals and a tilt table test may help you find dysautonomia or POTS as the cause of your fatigue. Some patients experience profound fatigue with post-exertional worsening, unrefreshing sleep, cognitive difficulties, widespread pain. Myalgic encephalomyelitis or chronic fatigue syndrome is a clinical diagnosis made after careful exclusion of other causes. As you can see, many different diseases across many different body systems can cause your fatigue, and this is not even an exhaustive list. Fatigue is not a diagnosis, it is a signal, and while basic labs are essential, they are only the starting point. Many causes of fatigue are common, identifiable, and treatable, but diagnosis often requires persistence, pattern recognition, and follow-up. If you are struggling with unexplained fatigue, track your symptoms, look for patterns, advocate for yourself, and work collaboratively with your physician, because feeling exhausted is not something you should simply accept as normal. If you found this helpful, make sure you like and subscribe. I create these videos to help you understand your body, your labs, and your health at a deeper level. And if you've ever been told everything is normal, but you knew something wasn't right, you are exactly why this channel exists.